Introduction to fertility therapy. Fertility therapy encompasses a broad range of medical and supportive interventions designed to help individuals and couples achieve conception and successful pregnancy. This field addresses various challenges related to reproductive health, offering solutions for those struggling with infertility. It combines advanced medical science with compassionate patient care, recognizing the profound emotional and psychological impact of fertility issues. Understanding the foundations of fertility therapy is crucial for anyone entering this specialized area, as it lays the groundwork for more complex topics. The goal is to restore or enhance reproductive function, utilizing both conventional and innovative techniques. This diploma provides a holistic overview, preparing practitioners to assist patients effectively. The journey through fertility therapy often involves multiple stages, from initial diagnosis and counseling to advanced medical procedures and ongoing support. Therapists play a vital role in guiding patients through these stages, providing information, emotional support, and practical advice. They work collaboratively with medical professionals to ensure a coordinated and patient-centered approach to care. This introduction sets the stage for exploring the intricate details of human reproduction and the various interventions available. It emphasizes the importance of a multidisciplinary approach to achieve the best possible outcomes for patients. Understanding human reproduction. A fundamental understanding of human reproductive anatomy and physiology is essential for any fertility therapist. This includes knowledge of the male and female reproductive organs, their functions, and the complex hormonal interactions that regulate the reproductive cycle. For females, this involves comprehending the ovarian cycle, ovulation, menstruation, and the role of hormones like estrogen and progesterone. For males, it requires understanding spermatogenesis, sperm maturation, and the influence of testosterone. Grasping these intricate processes allows therapists to better explain diagnostic findings and treatment options to patients. It forms the bedrock upon which all fertility interventions are based, ensuring a comprehensive approach to care. This foundational knowledge is critical for identifying potential areas of dysfunction. The process of fertilization, from sperm meeting egg to the initial stages of embryonic development, is a marvel of biological coordination. Therapists must be familiar with the cellular events involved in conception, including capacitation, acrosome reaction, and syngamy. They should also understand the early stages of embryo implantation and the establishment of pregnancy. This knowledge helps in explaining procedures like IVF and ICSI, where these natural processes are mimicked or assisted. A clear grasp of normal reproductive function provides the context for understanding when and why fertility issues arise. It empowers therapists to communicate effectively with patients about their reproductive health. Causes of infertility. Overview. Infertility is defined as the inability to conceive after a year of unprotected intercourse, or 6 months for women over 35. It is a complex condition with numerous potential causes, affecting both men and women equally, and sometimes involving a combination of factors. Understanding the general categories of infertility causes is the first step in diagnosis and treatment planning. These categories include ovulatory disorders, tubal factors, uterine anomalies, male factor issues, and unexplained infertility. Environmental factors, lifestyle choices, and genetic predispositions can also play significant roles. A thorough investigation is often required to pinpoint the specific underlying issues. This overview provides a framework for understanding the diverse challenges faced by infertile couples. Unexplained infertility, where no specific cause can be identified after comprehensive testing, can be particularly challenging for patients and practitioners alike. Even in these cases, various treatment options are available, often starting with less invasive methods before progressing to assisted reproductive technologies. It is also important to recognize that sometimes infertility is a result of a combination of minor issues in both partners, rather than a single major problem. Age is a significant factor, especially for women, as both egg quantity and quality decline with advancing age. This section highlights the multifaceted nature of infertility, emphasizing the need for a systematic and empathetic approach to diagnosis and care. Diagnostic approaches in fertility. Accurate diagnosis is the cornerstone of effective fertility therapy, guiding the selection of appropriate treatments. A comprehensive diagnostic workup typically involves a series of tests for both partners to identify underlying causes of infertility. For women, this often includes hormonal blood tests to assess ovarian function, ovulation tracking, and imaging studies like hysterosalpingography, HSG, to evaluate fallopian tube patency and uterine structure. Ultrasound examinations are also crucial for assessing ovarian reserve and uterine health. These tests help pinpoint issues such as ovulatory disorders, blocked fallopian tubes, or uterine abnormalities. The diagnostic process is systematic and thorough, aiming to leave no stone unturned in the search for answers. For men, diagnostic testing primarily focuses on semen analysis, which evaluates sperm count, motility, and morphology. Additional tests may include hormonal evaluations, genetic screening, and specialized sperm function tests if initial results are abnormal. Sometimes, a post-coital test or immunological screening may also be performed for both partners. The goal of these diagnostic approaches is to create a complete picture of a couple's reproductive health, enabling fertility specialists to develop a personalized treatment plan. Therapists assist patients in understanding these tests, preparing for them, and interpreting the results, providing crucial support throughout this often anxious period. Female reproductive anatomy. The female reproductive system is a complex and finely tuned network of organs designed for reproduction. It includes the ovaries, fallopian tubes, uterus, cervix, and vagina, each playing a critical role in the reproductive process. The ovaries are responsible for producing eggs, ova, and female hormones like estrogen and progesterone. The fallopian tubes serve as pathways for the egg to travel from the ovary to the uterus and are typically where fertilization occurs. The uterus is a muscular organ where a fertilized egg implants and develops during pregnancy. Understanding the precise location and function of these organs is fundamental for comprehending female fertility issues. Any structural or functional anomaly in these components can significantly impact a woman's ability to conceive. The cervix acts as a gateway between the uterus and the vagina, playing a role in sperm transport and protecting the developing fetus. The vagina is the birth canal and also receives sperm during intercourse. Beyond the primary organs, the pelvic floor muscles and supporting ligaments also contribute to reproductive health. Hormonal regulation, primarily from the pituitary gland and ovaries, orchestrates the entire menstrual cycle, preparing the body for potential pregnancy each month. A thorough knowledge of this intricate anatomy and its physiological processes allows fertility therapists to better educate patients about their condition and the rationale behind various diagnostic tests and treatments. Ovulatory dysfunction. Ovulatory dysfunction is one of the most common causes of female infertility, accounting for a significant percentage of cases. It refers to irregularities or absence of ovulation, the process where a mature egg is released from the ovary. Conditions like polycystic ovary syndrome, PCOS, are primary culprits, characterized by hormonal imbalances that disrupt normal follicular development and egg release. Other causes can include hypothalamic amenorrhea, premature ovarian insufficiency, and thyroid disorders, all of which interfere with the delicate hormonal cascade required for ovulation. Identifying the specific type of ovulatory dysfunction is crucial for tailoring effective treatment strategies. Therapists help patients understand their diagnosis and the implications for their fertility journey. Symptoms of ovulatory dysfunction often include irregular or absent menstrual periods, making it difficult for women to track their fertile window. Diagnostic methods involve hormonal blood tests to measure levels of FSH, LH, estrogen, and prolactin, as well as ultrasound examinations to assess ovarian follicle development. Treatment options range from lifestyle modifications, such as diet and exercise, to medications like clomiphene citrate or letrozole, which stimulate ovulation. In more complex cases, injectable gonadotropins may be used, sometimes in conjunction with assisted reproductive technologies. Providing clear information and emotional support during these treatments is a key role for fertility therapists. Tubal and uterine factors. Tubal factors, primarily blocked or damaged fallopian tubes, are a significant cause of female infertility. The fallopian tubes are essential for transporting the egg from the ovary to the uterus and are the typical site of fertilization. Damage to these delicate structures can result from pelvic inflammatory disease, PID, endometriosis, previous abdominal surgery, or sexually transmitted infections. Blockages prevent sperm from reaching the egg or a fertilized egg from reaching the uterus, leading to infertility or ectopic pregnancy. Diagnosing tubal issues often involves a hysterosalpingam, HSG, or laparoscopy, which allow direct visualization or assessment of tubal patency. Understanding these anatomical challenges is critical for effective intervention. Uterine factors, including structural abnormalities or conditions affecting the uterine lining, can also impede conception or successful pregnancy. Conditions such as fibroids, polyps, uterine septa, or Asherman syndrome, intrauterine adhesions, can interfere with embryo implantation or fetal development. These issues can lead to recurrent miscarriages or difficulty carrying a pregnancy to term. Diagnosis typically involves ultrasound, hysteroscopy, or MRI. Treatment options vary depending on the specific condition and may include surgical removal of fibroids or polyps or correction of structural anomalies. Fertility therapists help patients navigate these diagnoses, explaining the impact on fertility and the available surgical or medical solutions. Endometriosis and PCOS. Endometriosis is a chronic condition where tissue similar to the lining of the uterus, endometrium, grows outside the uterus, often on the ovaries, fallopian tubes, and other pelvic organs. This misplaced tissue responds to hormonal changes, leading to inflammation, pain, and the formation of scar tissue and adhesions. Endometriosis can impair fertility by distorting pelvic anatomy, damaging fallopian tubes, affecting egg quality, or interfering with embryo implantation. Its severity varies widely, and diagnosis often requires laparoscopy. Managing endometriosis for fertility involves a combination of medical and surgical approaches, aiming to reduce pain and improve reproductive outcomes. Therapists provide crucial support for patients coping with this often debilitating condition. Polycystic ovary syndrome, PCOS, is a common endocrine disorder characterized by hormonal imbalances, irregular periods, and the development of multiple small cysts on the ovaries. Key features include elevated androgen levels, insulin resistance, and ovulatory dysfunction. PCOS significantly impacts fertility by disrupting the normal release of eggs, making conception challenging. Diagnosis involves clinical symptoms, hormonal blood tests, and ultrasound findings. Treatment strategies for PCOS-related infertility often focus on lifestyle modifications, such as diet and exercise, to manage insulin resistance and weight. Ovulation-inducing medications are also frequently used. Understanding both endometriosis and PCOS is vital for fertility therapists, as these conditions represent two of the most prevalent causes of female infertility. Male reproductive anatomy. The male reproductive system is designed for the production, maturation, and delivery of sperm, essential for fertilization. Key organs include the testes, epididymis, vas deferens, seminal vesicles, prostate gland, and urethra. The testes are the primary reproductive organs, responsible for spermatogenesis, sperm production, and testosterone synthesis. The epididymis is a coiled tube where sperm mature and are stored. The vas deferens transports mature sperm from the epididymis to the ejaculatory duct. Understanding the intricate structure and function of these organs is paramount for diagnosing and treating male infertility. Any disruption in this complex system can impair a man's reproductive capacity, highlighting the need for detailed anatomical knowledge. The seminal vesicles and prostate gland contribute fluids that form semen, providing nourishment and a transport medium for sperm. The urethra serves as the exit pathway for both urine and semen. Hormonal regulation, primarily involving the hypothalamus, pituitary gland, and testes, controls spermatogenesis and testosterone production. Luteinizing hormone, LH, and follicle-stimulating hormone, FSH, from the pituitary gland play crucial roles in stimulating the testes. A comprehensive grasp of male reproductive anatomy and physiology allows fertility therapists to effectively explain male factor infertility to patients, discuss diagnostic findings, and outline potential treatment strategies. This knowledge ensures a holistic approach to male reproductive health. Sperm production and function. Spermatogenesis, the process of sperm production, is a continuous and highly regulated process occurring within the seminiferous tubules of the testes. It involves a complex series of cell divisions and differentiation, transforming germ cells into mature spermatozoa. This process takes approximately 72 days and is sensitive to various internal and external factors, including temperature, hormones, and environmental toxins. Each mature sperm consists of a head containing genetic material, a midpiece packed with mitochondria for energy, and a tail, flagellum, for motility. The quality and quantity of sperm are critical determinants of male fertility. Understanding the intricacies of this process is essential for identifying potential points of failure. Sperm function extends beyond just production. It also involves proper maturation and the ability to navigate the female reproductive tract to fertilize an egg. Sperm motility, their ability to swim effectively, and morphology, their shape and structure, are crucial for successful fertilization. Capacitation, a series of physiological changes sperm undergo in the female reproductive tract, prepares them for fertilization. Any defects in sperm production, maturation, or function can lead to male factor infertility. Fertility therapists educate patients about these processes and the factors that can influence sperm health, helping them understand the results of semen analysis and the rationale behind various interventions. Causes of male infertility. Male infertility can stem from a wide array of factors affecting sperm production, transport, or function. Common causes include varicocele, a condition where veins in the scrotum become enlarged, leading to increased testicular temperature and impaired sperm quality. Hormonal imbalances, such as low testosterone or issues with pituitary hormones, can disrupt spermatogenesis. Genetic factors, including chromosomal abnormalities or microdeletions on the Y chromosome, can also lead to severe sperm production problems. Infections, such as mumps or orchitis or sexually transmitted infections, can damage the testes or block the reproductive ducts. Understanding these diverse etiologies is crucial for accurate diagnosis and targeted treatment strategies. Obstructions in the reproductive tract, such as blockages in the epididymis or vas deferens due to infection, trauma, or congenital absence, can prevent sperm from being ejaculated. Lifestyle factors, including smoking, excessive alcohol consumption, obesity, and exposure to certain environmental toxins or medications, can negatively impact sperm health. Ejaculatory disorders, such as retrograde ejaculation, also contribute to infertility. In some cases, male infertility remains unexplained even after thorough investigation. Fertility therapists play a vital role in educating men about these potential causes, discussing preventive measures, and supporting them through diagnostic and treatment processes, fostering a sense of shared understanding and hope. Diagnostic tests for males. The primary diagnostic tool for male infertility is semen analysis, a comprehensive evaluation of ejaculated semen. This test assesses several key parameters, including sperm count, concentration, motility, percentage of moving sperm, and morphology, percentage of normally shaped sperm. It also measures semen volume, pH, and the presence of white blood cells, which can indicate infection. Abnormal results in any of these parameters can point towards specific issues affecting male fertility. Semen analysis provides crucial initial insights into a man's reproductive potential, guiding further diagnostic steps. It is a non-invasive and highly informative test that forms the foundation of male fertility assessment. If semen analysis reveals abnormalities, further investigations may be necessary. These can include hormonal blood tests to measure levels of testosterone, FSH, LH, and prolactin, which help identify endocrine imbalances. Genetic testing, such as karyotyping or Y chromosome microdeletion analysis, may be performed if severe sperm production issues are present. Testicular biopsy might be considered in cases of azoospermia, absence of sperm. To differentiate between obstructive and non-obstructive causes, imaging studies like scrotal ultrasound can detect varicoceles or other anatomical abnormalities. Fertility therapists help men understand the purpose and implications of these tests, providing support and clear explanations throughout the diagnostic journey. Overview of ART procedures. Assisted reproductive technologies, ART, encompass a range of medical procedures used to achieve pregnancy by handling sperm and/or eggs outside the body. ART offers hope to many individuals and couples who cannot conceive naturally due to various fertility challenges. The most common and well-known ART procedure is in vitro fertilization, IVF, but the field includes several other techniques tailored to specific needs. These technologies have revolutionized fertility treatment, providing solutions for complex cases of male and female infertility. Understanding the general principles and applications of ART is fundamental for fertility therapists, as they often guide patients through these intricate processes. ART represents a significant advancement in reproductive medicine, offering pathways to parenthood. The decision to pursue ART is a significant one, involving emotional, financial, and ethical considerations. Therapists play a crucial role in preparing patients for ART, explaining the procedures, potential outcomes, and managing expectations. They also provide support during the often stressful treatment cycles. Common ART procedures include IVF, intracytoplasmic sperm injection, ICSI, and gamete zygote intrafallopian transfer, GIFT, ZIFT. Each technique has specific indications and involves different steps, but all aim to facilitate fertilization and embryo development. This overview provides a foundational understanding of the ART landscape, setting the stage for a deeper dive into individual procedures. In vitro fertilization, IVF process. In vitro fertilization, IVF, is the most widely known and successful ART procedure, involving several distinct stages. The process typically begins with ovarian stimulation, where medications are administered to encourage the ovaries to produce multiple eggs. This is followed by egg retrieval, a minor surgical procedure to collect the mature eggs from the ovaries. Simultaneously, a sperm sample is collected from the male partner or a donor. The eggs and sperm are then combined in a laboratory dish where fertilization occurs in vitro, outside the body. The resulting embryos are cultured for several days, allowing them to develop before transfer. Understanding each step is crucial for patient education and support. After several days of culture, one or more healthy embryos are selected for embryo transfer, where they are carefully placed into the woman's uterus. Any remaining viable embryos can be cryopreserved, frozen for future use. The final stage is the luteal phase support, where hormonal medications are given to support the uterine lining and enhance the chances of implantation. IVF is a complex and emotionally demanding process, and fertility therapists play an indispensable role in guiding patients through each stage, providing detailed explanations, managing expectations, and offering continuous emotional support. This comprehensive approach helps patients navigate the challenges and hopes associated with IVF treatment. Intracytoplasmic sperm injection, ICSI. Intracytoplasmic sperm injection, ICSI, is a specialized ART procedure often used in conjunction with IVF, particularly in cases of severe male factor infertility or previous IVF failures. Unlike conventional IVF, where sperm and egg are left to fertilize naturally in a dish, ICSI involves directly injecting a single sperm into the cytoplasm of an egg. This technique bypasses many of the natural barriers to fertilization, making it highly effective for men with very low sperm counts, poor sperm motility, or abnormal morphology. It is also used when sperm are retrieved surgically from the testes or epididymis. Understanding the precise application and benefits of ICSI is crucial for fertility therapists. The ICSI procedure requires highly skilled embryologists and specialized micromanipulation equipment. After egg retrieval, a single healthy sperm is selected and injected into each mature egg. The fertilized eggs, zygotes, are then cultured in the laboratory, similar to conventional IVF, and developing embryos are subsequently transferred to the uterus. ICSI significantly increases the chances of fertilization in challenging cases, offering a viable pathway to parenthood for many couples. Therapists educate patients about the indications for ICSI, the procedure itself, and its potential outcomes, ensuring they are well-informed and emotionally prepared for this advanced treatment option. Gamete and zygote intrafallopian transfer, GIFT, ZIFT. Gamete intrafallopian transfer, GIFT, and zygote intrafallopian transfer are less commonly performed ART procedures today compared to IVF and ICSI, but they represent important historical and alternative approaches. In GIFT, eggs are retrieved from the woman's ovaries and immediately mixed with sperm in a laboratory dish. This mixture of gametes, eggs and sperm, is then directly transferred into the woman's fallopian tubes, allowing fertilization to occur naturally within the body. GIFT requires at least one healthy, unblocked fallopian tube for the procedure to be viable. It was developed to mimic the natural fertilization process more closely than early IVF techniques. Understanding these methods provides a broader perspective on ART evolution. ZIFT is a variation of GIFT, where fertilization occurs in vitro, similar to IVF, but the resulting zygotes, fertilized eggs, are then transferred into the fallopian tubes rather than the uterus. This allows the early embryonic development to occur within the natural environment on the fallopian tube before reaching the uterus. Both GIFT and ZIFT require laparoscopic surgery for the transfer, which is more invasive than the uterine embryo transfer used in IVF. While their use has declined with advancements in IVF, knowing about GIFT and ZIFT is valuable for a comprehensive understanding of ART options and their historical context. Therapists should be aware of these methods, even if rarely encountered in modern practice. Egg and sperm donation are crucial options for individuals and couples facing severe infertility issues that cannot be resolved with their own gametes. Egg donation involves using eggs from a donor, which are then fertilized with the recipient partner's sperm or donor sperm via IVF, and the resulting embryos are transferred to the recipient's uterus. This is often an option for women with diminished ovarian reserve, premature ovarian insufficiency, or genetic conditions they wish to avoid passing on. Sperm donation involves using sperm from a donor, which can be used for intrauterine insemination, IUI, or IVF. This is a solution for men with azoospermia, severe male factor infertility, or genetic concerns. These options allow many to experience parenthood. The process of gamete donation involves rigorous screening of donors to ensure their health, genetic suitability, and psychological well-being. Recipients undergo counseling to prepare for the unique emotional and psychological aspects of using donor gametes, including discussions about disclosure to future children. Fertility therapists play a critical role in facilitating these conversations, providing support, and addressing complex family-building dynamics. Legal and ethical considerations are also paramount, ensuring the rights and responsibilities of all parties are clearly defined. Understanding the nuances of egg and sperm donation is essential for guiding patients through these deeply personal and significant decisions. Surrogacy and gestational carriers. Surrogacy is a family-building option where a woman carries a pregnancy for another individual or couple known as the intended parents. There are two main types: traditional surrogacy and gestational surrogacy. In traditional surrogacy, the surrogate's own egg is fertilized with the intended father's sperm, or donor sperm, meaning the surrogate is genetically related to the child. This method is less common today due to complex legal and emotional considerations. Gestational surrogacy, which is far more prevalent, involves transferring an embryo created from the intended parents or donor eggs, and sperm into the gestational carrier's uterus. The gestational carrier has no genetic link to the child. Understanding these distinctions is vital for therapists. Gestational surrogacy offers a pathway to parenthood for intended parents who cannot carry a pregnancy themselves due to medical reasons, uterine issues, recurrent pregnancy loss, or for same-sex male couples. The process involves extensive medical, psychological, and legal screening for both the intended parents and the gestational carrier. Fertility therapists play a crucial role in providing comprehensive counseling to all parties, addressing the emotional complexities, expectations, and potential challenges. Legal agreements are meticulously drafted to protect the rights and responsibilities of everyone involved. This option requires careful navigation and robust support systems, ensuring a positive experience for all parties and the well-being of the child. Fertility preservation techniques. Fertility preservation offers individuals the opportunity to safeguard their reproductive potential for future use, particularly when facing medical treatments or life circumstances that could compromise fertility. The most common techniques include egg freezing, oocyte cryopreservation, sperm freezing, sperm cryopreservation, and embryo freezing, embryo cryopreservation. Egg freezing is increasingly popular for women delaying childbearing for personal or professional reasons, or those undergoing cancer treatment. Sperm freezing is a well-established method for men facing similar challenges, or for those undergoing vasectomy. These techniques provide a sense of control and hope for future family building. Understanding these options is crucial for comprehensive patient counseling. Embryo freezing is typically performed after IVF, where fertilized eggs are cryopreserved. This is an option for couples who have completed their family but wish to preserve embryos, or for those undergoing treatments that might affect future fertility. Ovarian tissue freezing, a more experimental technique, is sometimes offered to young girls or women who cannot undergo ovarian stimulation. Testicular tissue freezing is also an emerging option for prepubertal boys. Fertility therapists play a vital role in discussing these options with patients, explaining the procedures, success rates, and associated costs. They provide emotional support during the decision-making process and throughout the preservation journey, empowering patients to make informed choices about their reproductive future. Genetic screening and testing. Genetic screening and testing play an increasingly important role in fertility therapy, helping to identify genetic conditions that could affect conception, embryo development, or the health of a future child. Preconception carrier screening, PCS, is offered to prospective parents to determine if they carry genes for certain recessive genetic disorders, such as cystic fibrosis or spinal muscular atrophy. If both partners are carriers for the same condition, there is a risk of passing it on to their offspring. This information allows couples to make informed decisions about family planning, including considering pre-implantation genetic testing or donor gametes. Understanding these screening options is crucial for comprehensive patient counseling. Pre-implantation genetic testing, PGT, is performed on embryos created through IVF before they are transferred to the uterus. PGT includes PGTA for aneuploidy, detecting chromosomal abnormalities like Down syndrome, PGTM for monogenic disorders, detecting specific single-gene defects, and PGT-SR for structural rearrangements, detecting chromosomal translocations. This testing helps select healthy embryos for transfer, reducing the risk of miscarriage and genetic disorders. Post-conception, prenatal genetic testing, examples amniocentesis, chorionic villus sampling, can also be performed. Fertility therapists educate patients about the benefits, limitations, and ethical considerations of genetic testing, providing sensitive support throughout this complex decision-making process. Nutritional and lifestyle factors significantly impact both male and female fertility, often playing a crucial role in the success of fertility treatments. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins provides essential nutrients for reproductive health. Specific nutrients like folic acid, zinc, selenium, and omega-3 fatty acids are particularly important for gamete quality and hormonal balance. Conversely, diets high in processed foods, trans fats, and excessive sugar can negatively affect fertility. Maintaining a healthy body weight is also critical, as both underweight and overweight obesity can disrupt hormonal regulation and ovulatory function in women, and impairs sperm quality in men. Therapists guide patients on optimizing their diet. Beyond nutrition, various lifestyle choices profoundly influence fertility. Regular, moderate exercise is beneficial, but excessive or strenuous exercise can sometimes be detrimental, especially for women. Smoking, alcohol consumption, and recreational drug use are known to harm both egg and sperm quality and reduce pregnancy rates. Stress, while not a direct cause of infertility, can exacerbate existing issues and impact treatment outcomes. Adequate sleep and managing environmental toxin exposure are also important considerations. Fertility therapists provide comprehensive counseling on these lifestyle modifications, empowering patients to make positive changes that can enhance their natural fertility and improve the chances of success with medical interventions. Psychological impact of infertility. Infertility is not merely a medical condition. It carries a profound psychological and emotional burden for individuals and couples. The diagnosis and treatment journey can evoke a wide range of intense emotions, including grief, loss, anger, anxiety, depression, and guilt. Patients often experience a sense of isolation and may feel misunderstood by friends and family who haven't experienced similar challenges. The constant cycle of hope and disappointment with each menstrual cycle or failed treatment can be emotionally exhausting. Recognizing and validating these feelings is a critical aspect of fertility therapy. Therapists must approach patients with empathy and understanding, acknowledging the depth of their emotional experience. The stress associated with infertility can also strain relationships, both with partners and within social circles. Sexual intimacy can become mechanical and lose its spontaneity, adding further pressure. Men and women often cope with infertility differently, which can lead to misunderstandings between partners. The financial strain of treatments, combined with the emotional toll, can create a significant burden. Fertility therapists are essential in helping patients navigate these psychological challenges, providing coping strategies, communication tools, and a safe space to process their emotions. Addressing the psychological impact is as important as the medical treatment itself for holistic patient care and well-being. Counseling and support systems. Comprehensive counseling and robust support systems are integral components of effective fertility therapy. Addressing the significant psychological and emotional impact of infertility, fertility counselors, often trained psychologists or social workers, provide a safe and confidential space for individuals and couples to process their feelings, develop coping mechanisms, and make informed decisions. Counseling can help manage stress, anxiety, and depression, and improve communication between partners. It also prepares patients for the emotional rollercoaster of fertility treatments, including potential successes and disappointments. This specialized support is crucial for maintaining mental well-being throughout the fertility journey. Beyond individual and couples counseling, support groups offer a valuable platform for patients to connect with others who share similar experiences. Sharing stories, advice, and emotional support with peers can reduce feelings of isolation and foster a sense of community. Many fertility clinics and organizations offer these groups, recognizing their therapeutic benefits. Online forums and resources also provide accessible avenues for support. Fertility therapists play a key role in connecting patients with these resources, ensuring they have access to a comprehensive network of care. Integrating psychological support with medical treatment leads to better overall outcomes and a more positive patient experience, emphasizing the holistic nature of fertility care. Ethical and legal considerations. The field of fertility therapy is replete with complex ethical and legal considerations that demand careful navigation. Issues surrounding the creation, storage, and disposition of embryos, particularly in cases of divorce or death, require clear policies and legal frameworks. The use of donor gametes and surrogacy raises questions about parental rights, genetic lineage, and the welfare of all parties involved, including the future child. Ethical debates also revolve around the limits of genetic testing, such as selecting for specific traits and the potential for designer babies. Fertility therapists must be well versed in these ethical dilemmas and legal precedents to provide responsible and informed guidance to patients. Legal frameworks vary significantly across different jurisdictions, impacting access to and the permissibility of certain fertility treatments. For instance, laws regarding surrogacy, posthumous conception, and the number of embryos that can be transferred differ widely. Informed consent is paramount in all fertility procedures, ensuring patients fully understand the risks, benefits, and alternatives. Therapists play a crucial role in ensuring patients are aware of their legal rights and responsibilities, and in facilitating discussions about complex ethical choices. They often work in conjunction with legal professionals to ensure all agreements are robust and legally sound, safeguarding the interests of all involved parties and upholding the highest ethical standards in reproductive medicine. Emerging technologies in fertility. The field of fertility therapy is constantly evolving, with new technologies and research breakthroughs emerging regularly. One exciting area is mitochondrial donation, a technique designed to prevent the transmission of certain mitochondrial diseases from mother to child. This involves replacing the affected mitochondria in an egg with healthy mitochondria from a donor egg. Another promising avenue is artificial gametogenesis, where stem cells are coaxed into developing into functional sperm or egg cells, potentially offering solutions for individuals with severe gamete production issues. These cutting-edge technologies represent the forefront of reproductive science. Therapists must stay informed about these advancements to provide up-to-date information to patients. Uterine transplantation, though still in its early stages and highly complex, offers hope for women without a functional uterus to carry a pregnancy. Research into gene editing technologies, such as CRISPR, also holds potential for correcting genetic defects in embryos, though this raises significant ethical concerns. Advances in artificial intelligence and machine learning are being explored to improve embryo selection and optimize IVF outcomes. While many of these technologies are still experimental or limited in application, they underscore the dynamic nature of fertility therapy. Fertility therapists need to understand the potential and limitations of these emerging technologies, guiding patients with realistic expectations and ethical considerations as the field continues to advance. Professional practice and ethics. Professional practice in fertility therapy demands a high level of competence, empathy, and adherence to ethical guidelines. Therapists must maintain up-to-date knowledge of reproductive medicine, counseling techniques, and relevant legal frameworks. Continuous professional development, including attending conferences and workshops, is essential for staying current in this rapidly evolving field. Maintaining strict confidentiality and respecting patient privacy are paramount, building trust and ensuring a safe environment for vulnerable individuals. Therapists must also recognize the limits of their own expertise and know when to refer patients to other specialists, such as medical doctors, genetic counselors, or legal advisors. This commitment to professional excellence ensures the highest quality of care. Ethical considerations permeate every aspect of fertility therapy, requiring therapists to navigate complex moral dilemmas with integrity. Issues such as patient autonomy, beneficence, non-maleficence, and justice must guide all decisions and interactions. Therapists often assist patients in making deeply personal and ethically challenging choices, such as embryo disposition, donor selection, or selective reduction. They must remain neutral and non-judgmental, supporting patients in their own decision-making processes while upholding professional standards. Adherence to professional codes of conduct and ethical guidelines is not just a legal requirement, but a moral imperative, ensuring that patient well-being and dignity are always at the forefront of fertility care. This ethical foundation is critical for responsible practice.